Most towns don't collapse overnight. First, the hospital closes. Then the grocery store disappears. Then the water system starts breaking down. Then the school merges with another district miles away. And one day, people realize the town is still on the map, but daily life doesn't really work there anymore. In Thomasville, Alabama, a hospital that took nearly 10 years to build closed after less than 5 years. In Trinity, Texas, a hospital came back, then shut down again 14 months later. In Cairo, Illinois, a grocery store opened with hope and closed before the town could escape being a food desert again. These are American towns losing the things people need most. Thomasville, Alabama. The hospital that took a decade to build. Sheldon Day spent nearly 10 years trying to get a hospital built in Thomasville, Alabama. He made calls, attended meetings, fought through bureaucracy, and kept pushing. In 2020, Thomasville Regional Medical Center finally opened. State-of-the-art equipment, a 3D mammogram, an MRI scanner, surgeons, specialists. For a rural community in one of the most medically underserved congressional districts in the entire country, this wasn't just a hospital. It was proof that something could actually go right. Then COVID hit. Thomasville Regional Medical Center was one of only 3 hospitals nationwide that did not receive federal COVID relief funding. The reasons were technical. The impact was not. The hospital that opened in March 2020 struggled from day one. Private insurers were paying roughly half of what it actually cost to deliver care. Staff went unpaid. Doctors offered their own money to keep the lights on. The owner refused to sign personal guarantees to cover the shortfall. In September 2024, a handwritten sign appeared on the door, closed until further notice. It's almost apocalyptic, Mayor Day said. You walk through and wonder, did the rapture happen and leave us behind? Residents now drive an hour and a half in any direction to reach a hospital. Montgomery, Mobile, Meridian, any direction, an hour and a half. As of this recording, a sale is reportedly in progress. The hospital may reopen. But the community that waited 10 years to get one has now spent the better part of 2 years without it, and they know, more clearly than most, that getting a hospital and keeping a hospital are 2 completely different things. Trinity, Texas, the hospital that came back, then left again. In 2019, Bill Elliott had a heart attack in Trinity, Texas. Trinity's only hospital had closed 2 years earlier. His neighbor had to drive him 45 minutes down 2-lane country roads to reach an emergency room. By the time they arrived, his enzyme levels were rising. He was transferred by ambulance to a larger facility another hour away. He survived. His story helped make the case for bringing a hospital back to Trinity. In February 2024, Mid-Coast Medical Center opened its doors. The community celebrated. 14 months later, it closed. The problem was bureaucratic and brutal. To partner with insurance companies, the hospital had to be licensed through Medicare first. That process took nearly a year. For 14 months, they delivered care without receiving reimbursement for most of it. The money ran out. The money has run out, and it's just not sustainable at this point, the CEO said. Trinity residents are once again driving 30 miles to reach an emergency room. The hospital building still stands, the equipment is still inside, but the doors are locked. A rural hospital is a really, really hard thing to do, said the head of Texas's Rural Hospital Association. The reasons that the original hospital closed the first time still existed when they tried again. Trinity is not a cautionary tale about ambition. It's a cautionary tale about a system that makes it nearly impossible for rural communities to access basic medical care, even when everyone involved is trying their hardest. Blanco, Texas, when the water stops working. Blanco, Texas is a hill country town of about 2,300 people, 50 miles southwest of Austin. In January 2024, a water main broke. Freezing temperatures, aging pipes, the whole town lost running water. This wasn't the first time, and it almost certainly won't be the last. City officials had already identified 3 major water lines in serious disrepair. The infrastructure is old. The pipes have been breaking for years. Fixing it properly would cost millions of dollars, and that is money a small town simply doesn't have sitting around. Blanco has since secured state funding for some repairs and signed a 2 5-year agreement with its water supplier. The mayor called it a major milestone. And compared to doing nothing, it is. But the broader picture is harder to celebrate. Across Texas, water infrastructure is failing at a scale that state funding can barely touch. Texas utilities lose an estimated 136 billion gallons of water annually to leaking pipes. In 2025, there were over $4.6 billion in applications for water funding and only $444 million available. That's $10 of need for every $1 that exists. For Blanco and hundreds of towns like it, the math is simple and terrible. The pipes are old, the money isn't there, and at some point, the water is going to stop working again. Clean running water is the most basic infrastructure there is. Most Americans have never had to think about it. In a growing number of small American towns, it's becoming something you can't take for granted. McDowell County, West Virginia, when everything goes at once. McDowell County, West Virginia, once had over 100,000 residents. Today, it has fewer than 17,000. The coal mines that built this county are largely gone. The entire county is now classified as a food desert. There are no full-service grocery stores. Schools have been consolidated and closed as enrollment collapses. The water system has been flagged for safety issues. The local newspaper shut down in 2023 after more than a century of publication. In 2026, CBS's 60 Minutes profiled the county. A local minister said what many residents have felt for decades: economic resurgence, renaissance of the coal industry, the elimination of poverty, fixing our water systems. Big promises and nothing ever changes. This is what makes McDowell County different from every other place in this video. It's not one thing. It's not even two or three things. The grocery store and the hospital and the school and the water system and the jobs, all declining at the same time for decades with no reversal in sight. Elsewhere, towns lose one thing at a time. In McDowell County, everything went at once. County officials have formed an organization called Prosper McDowell. Their motto: we're not waiting on somebody to come save us. Nobody argues with the spirit of that. But when everything falls apart at once, there's only so much a motto can do. East Palestine, Ohio. When trust is the last thing to go, every town in this video lost something you can see: a hospital, a grocery store, a working water pipe, a school, things you can photograph and point to. East Palestine, Ohio lost something you can't see. On the night of February 3rd, 2023, a Norfolk Southern freight train carrying hazardous materials derailed at the edge of this small town on the Ohio and Pennsylvania border. Several cars caught fire. To prevent a possible explosion, officials vented and burned vinyl chloride, a known carcinogen, releasing it into the air. Residents were evacuated, then told to return. Officials said the air and water were safe. Years later, that word, safe, is still the most contested word in East Palestine. Local health surveys and researchers have found unusually high reports of respiratory problems, neurological symptoms, skin irritation, anxiety, and stress-related illness among residents after the derailment. Some residents have reported even more serious health concerns, including cancer diagnoses. But the long-term science is still unfolding, and researchers are still trying to understand what may be connected to the chemicals released that night and what may not be. That uncertainty has become part of the trauma. One mother, whose son developed asthma in the months after the derailment, said families like hers were met with gaslighting and dismissals from state, local, and federal agencies. Norfolk Southern has committed over $1 billion to clean up and reached a $600 million class action settlement. NIH has committed $10 million over 5 years to study long-term health impacts. The studies are ongoing. The answers aren't there yet. And in the meantime, people are living in a town where they are not entirely sure whether their air is safe, whether their well water is safe, whether the ground their children play on is safe. The other towns in this video lost things that can, in theory, be replaced. A hospital can reopen, a grocery store can come back, pipes can be fixed. Trust, once lost, takes much longer. And in East Palestine, for a lot of residents, it hasn't come back yet. Cairo, Illinois, the town that's still on the map. Cairo sits at the confluence of the Ohio and Mississippi rivers. It is still technically a city. It has a mayor, a city hall, and a zip code. What it doesn't have is much else. The population has fallen from over 15,000 at its peak to fewer than 1,500 today. The county it sits in is Illinois' poorest and the fastest shrinking county in America. For years, Residents had to drive 30 miles to reach a Walmart or Kroger. The local option was Dollar General, which sold canned goods but no fresh produce. In 2023, after 18 months of planning and significant state investment, a community grocery cooperative called Rise opened. More than 100 people showed up on opening day. Board members held signs reading, "We are no longer a food desert." That same month, the Dollar General at the edge of town started selling fresh fruits, vegetables, and meat. Rise couldn't compete on price. The walk-in cooler broke. Customers drifted back to their old habits. On the 31st of January 2026, Rise closed, citing low foot traffic. Illinois invested $13.5 million in a grocery initiative to open 6 stores across the state. 4 of them have now closed. Cairo is a food desert again. Some problems don't have market solutions. Cairo has been waiting for one for a very long time.